I'm an ER doctor, so I'm on the front lines of treating people. I have a private practice that's a walk-in urgent care in New York City, and we were seeing people that were sick with fever and flu-like symptoms even before there was any confirmed cases in the United States. And so those people we tested for flu, they looked at me and said, I don't have the flu. Do you think that this is corona? And we were speculating that yes, but had no confirmation. So probably exposed in those early days of March. I got sick around the 12th of March and was sort of just lingering symptoms, a little fever, not too bad. Around day 7, I kind of took a turn for the worse.
Did you have the protective equipment from the very beginning, consulting people with flu-like symptoms?
Yeah, I mean, we were following the CDC recommendations, so we had protective equipment. But before there was any confirmed cases, we weren't advised that we needed to wear it continuously. And so we were not doing that. So there was some exposure before the indications to use protective equipment for all patients. So it was probably in that time frame. Got sick. At about 7 days, I felt much worse. I ended up checking myself into Mount Sinai Hospital, where I'm a physician in the ER, and basically got an x-ray and confirmed that I had pneumonia on both sides, what we call bilateral pneumonia. So that was a really scary moment. Certainly the biggest concern is getting the respiratory complications, and I was showing signs of that. My oxygen was good, which was the indication that I could treat myself at home. And I did start, under the advisement of my father-in-law, who's an infectious disease doctor, hydroxychloroquine and azithromycin in order to treat myself. So I was sick for a good 2 weeks. I was able to repeat my x-ray in 48 hours. It cleared up, but it was a real bad illness. Some people have minor symptoms, a little fever, maybe a dry cough. But then the other end of the spectrum, the full expression of this virus is severe respiratory problems. And certainly the people that are most severe are getting so much inflammation in their lungs, they have to be put on a ventilator.
Were you put on a ventilator? Did you need intubation? No.
No. I was treated at home. Luckily, I was oxygenating well and didn't need that level of care. But ironically, my father, who had just visited New York, got very sick when he returned home to Las Vegas. He was in the ICU, in critical care, needed to be put on the ventilator, and actually is recovering, but was on a ventilator for a week. So that was really scary, having a direct relative that had such severe disease, because in my mind, there's an expression of this virus that seems to be hereditary. People who get it bad, other members of their family also tend to get it bad. So I was particularly concerned about my own symptoms relative to my father being critically ill. And thank God he's recovered, which is nothing short of a miracle.
So when things aggravated, what were your symptoms? Like high fever, pains?
Not so much the high fever, but a really uncomfortable feeling in my chest, a tightness in my chest, and a very deep cough. This is a respiratory virus, so it affects the entire respiratory tract, starting from the throat all the way into the bronchioles and deeper in the lungs. The lung infections are what we worry about, and oftentimes you're not coughing so much, but the infection is deep that you can't even get it out. And that's where the inflammation tends to lock in, it tends to get complicated. Those are the people that need to be admitted to the hospital and potentially have to have the respiratory support of the ventilator.
If you were to compare it to a regular cold or a regular flu, what would you say? Much
worse for myself. But this is the problem. Not everybody has that. Some people just get a fever for 2 days. Some people only lose their sense of smell and they don't have any other symptoms. Other people, it's the digestive symptoms that is the indication, like diarrhea. So when we're taking care of patients, and I have a unique perspective because I had really bad infection and I can empathize with people who are also having the same type of symptoms. But when we're taking care of people, I often tell them, I think you're going to test positive. And they may believe me or they may understand that, but when we get the results back and we give them confirmation, almost every time the reaction is really, and that's the difficult part about corona is there's so many mild cases, there's so many asymptomatic carriers that you're having to educate people with an actual test to get them to realize, wow, I'm sick. Because everybody's watching the news. They're seeing the horrible cases of severe illness. So if you don't have severe illness, it's hard to relate that this is the same condition. So part of what we're doing is testing frequently. We're spending tons of time educating. We're trying to get the word out that this virus is everywhere. This is not 20,000 cases. This is hundreds of thousands, if not millions, in New York City.
I think it is essential, Dr. Jake Deutsch, to understand more about your lifestyle prior to this infection, because there is this general perception that young people can't catch the infection, that
Right.
young people with strong immunity are maybe less vulnerable to it.
Sure. I mean, I'm relatively young and I'm very active. I take care of myself. I don't have any medical conditions, and I ended up with pneumonia on both sides, and had a 2-week illness. So I would say that that's a pretty good indication that anybody could get sick from this. It doesn't discriminate necessarily because you're older. There is more illness amongst elderly people, but they also have other complicating factors. But I've seen a number of people in their 30s that have been critically ill. I know other doctors that have been super sick. They had to be on ventilators because they were on the front lines treating people, and they have limited medical problems. So there's no discerning who's going to get sick. And that's really what we should be most worried about. Because you have mild symptoms, you don't know if you're going to infect somebody who's going to have life-threatening symptoms. And everybody needs to be part of the process to slow the spread.
Did you get the magnitude, did you grasp the magnitude of it all from the very beginning, since the first day you learned about this new type of virus?
I don't think anybody had a good sense. I mean, that's part of the failure of our country and many other countries in terms of being prepared, being informed about what to expect, having solutions ahead of time that could have been more productive, testing, having drugs available, certainly supplies to protect people. So in that sense, I wasn't completely informed. And like I said, I kind of wanted to get the virus and get it over with, because in my assumption, it was going to be like a flu. And I wanted to be able to treat people. That's what I do. That's what I'm trained for. So the magnitude, I think, has surprised everyone. And certainly, getting that message across is so important so that we can prevent the spread. We are seeing some positive data. The number of hospital admissions are going down in New York City. We're having less ventilators used each day. So the isolation and the social distancing is working. Hopefully there's some more solutions in terms of medications. And I'm really proud to announce that in my practice in New York, we're actually starting antibody testing this week. So we're going to be able to do blood tests, most sensitive type of tests that are going to be detecting antibodies in the serum, which will be an indication of previous infection and immunity. So really getting ahead of the curve. But this is stuff that we're doing as an independent practice and partnering with independent laboratories. This is not federally funded. This is being creative. This is being nimble and reacting ahead of what is available for the general population.
Speaking of testing, how is the testing done in the United States? Because I'm looking to the situation in our country where we only do like 5,000 maybe, in the most optimistic scenario, 5,000 tests a day at a population of 18 million people, which we consider very little. How's the situation there?
We're getting better. In New York, there is some limitations of testing because there's so much demand in the hospital with critically ill. But, the availability is getting better. The labs that I'm working with had turnaround times of 4 days to 8 days to begin with. Now they're completing them within 24 hours. So they're getting the supplies that they need in order to run the test, the reagents, and all of the swabs. So we're really picking up. I've tested about 2,500 patients in my practice alone, which is not insignificant, considering, the scope of how many people have actually gotten tested in the United States. It's still lower than it needs to be. We need mass scale testing to identify patients. We need that to be able to identify asymptomatic carriers. And then we need antibody testing to be able to determine who's immune, who could go back to more normal activity without increasing the spread of this virus.
How did the experience you went through change you, and what did you learn from it that could help you deal with COVID patients?
Yeah, I definitely have seen the dark side of being sick. With my own illness, that was pretty severe. My father's illness, that was critical, and worrying that he wasn't going to survive. So the connection with patients is much stronger. If I had had minor illness and maybe just a day or two of a fever, I may not understand how scary it is to feel like you can't breathe, to be concerned that you're going to get worse and not know if you're going to need to be hospitalized. The level of empathy is like nothing else I've experienced. I've been an ER doctor for 20 years, and I've taken care of people with strokes and heart attacks and serious life-threatening problems. Not having had that myself, it doesn't put you on that same level.
What terrified you the most? What was the most frightening thing during this period?
I think the worry that I wasn't going to get better. Everything is so new in terms of what we know about this and why some people succumb to illness that leads to death and why people have such severe respiratory problems. It's unclear whether that what that is. So that fear of the unknown, the fear of mortality in myself, really shook me up. Certainly feeling great now, sort of have a new approach to seeing people every day. So proud to be back at work. Very proud of my staff in the office, taking care of people and being able to make a difference. I see glimmers of hope with people that are doing okay, with people interacting more compassionately and caring. So all of that has gone a long way to my personal experience with this, and I see that amongst people every day. So that's super positive.
I see a lot of political feuds in the United States, a lot of political wars, a lot of hesitation from the highest level. Does that reflect in any way on the situation in hospitals?
I mean, I think that there's a disconnect between hospitals and what they're doing and the government and their press conferences. So, there's a lot of frustration. There's a lot of sort of fear. But I think the bottom line, I can say, at least with my colleagues and my personal experience, is, when you go into medicine, the idea is to do no harm. It's to help others. And despite the political differences and frustrations, that's our number one mission. And the determination that the doctors have here in the United States to help our country and our people, I think is like anywhere else. That's the number one mission of what we do and why we wake up every day.
In the end, Dr. Jake Deutsch, tell us your number one recommendation for people all around the world.
So obviously the social distancing and isolation is important, but I think beyond that, what you can do to protect yourself is be vigilant. So if you do go outside and you are grocery shopping and doing some critical function, you still need to maintain strict protocols so that you don't get sick. Touching your face, adjusting your mask constantly. If you touch your mask to fix it and you touch a door handle, you've now basically touched the door handle to your face. So while you're going through all this effort of staying home and isolating, all of that can be negated if you're not extra cautious when you do have to go out. So I think that that's probably the most important tool that we can pass along to everybody. Be extra careful, take every precaution, treat this as like a life or death situation of protecting yourself. So I hope that everybody is able to maintain that. Obviously, the conditions aren't the same in every country, but we're learning from each other. Spreading information that's useful also is great. There's so much misinformation, there's so much, fake news. We want to make sure that we're really giving helpful advice to people to stay healthy.
Thank you so much, Dr. Jake Deutsch.
My pleasure.